I'm Dr. Diana Kerwin. I'm an internist and geriatrician. I've been working in the field of Alzheimer's disease diagnosis and management for 20 years. Yeah, the healthcare disparity issue, I think, is something really as a healthcare community, as an Alzheimer's community, that we really need to pay attention to. And I think I've actually worked at this both in the Chicago area, worked with several clinics, community clinics, in order to address some of the healthcare barriers we were seeing for underrepresented minority communities. And then in Dallas, when I moved here, the same issues apply. What I'm seeing, actually, the good news is that there's an awareness to it. And I think the more that we push our awareness of, we are not meeting the ideal goal of reaching every patient that's being affected by Alzheimer's disease. And we're not meeting it because there is healthcare disparities. There's barriers that apply to certain populations or underrepresented minorities that don't apply to others. Some of it's geography, some of it is economic, some of it is cultural understanding, some of it is healthcare providers understanding. And so the first part is recognizing that we are not doing a very good job yet. And I think that's the point, is that once we identify that we're not doing a good job, we can now rise up and say, okay, what are the issues? So in Dallas in general, the North Texas area in general, we do have different healthcare systems, and some of them are really serving some of the underrepresented minority communities very well. But the problem is that it's not every system can have every disease specialist available. So they might be serving the system very well, but there isn't a lot of dementia care specialists available in that system. And so the patients may be getting better primary care in certain areas, but we're still missing the mark as far as everyone with Alzheimer's and memory impairment. And what I found, what I've learned in other areas, and as well as what we're trying to look at in Dallas, is really looking at who are the leaders in those communities that we're not reaching. Going to them and saying, why are we not reaching you? How can we set up partnerships? How can we set up programs so that we can bring the right information in the right way and the right healthcare to those patients, to be sure and comfortable that someday we can say that we are reaching every patient and family that's experiencing Alzheimer's disease, regardless of where they live or who they are, or what their ethnic or racial background is, or what their economic background is. How do we get to that point? And so some of the things that I see that are working very well are some of those leaders in some of either the Latino or the Black community, basically creating programs and then bringing in the partners that maybe don't understand, or helping those partners understand the community better so that they can better serve them and develop systems. I do think it takes a lot of pushing. It's hard to change a system. And so you really have to look at it very expansively, but it really boils down to starting with, who are the patients that we can reach in this underserved minority community very quickly and get to them? And then how do we learn from that and then expand it out and basically really scale up those models of best practices? And so I still think we have a long way to go. We are working at it. I will say it's constantly on our mind on a daily basis. We know that there's many patients we're still not serving, we're not diagnosing, we're not caring for. But the point is that we really want to make that occur. That is the primary goal. So I think we just have to keep on working at it. And again, those sharing of best practices with healthcare systems that are doing really well with it is an important aspect in bringing in that information.